Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about lymphomas, and joining me is Dr. Mohammed JanJua with the University of Oklahoma Hematology Oncology Department. Welcome to the show, Doctor.
Thank you for having me, Pam.
Now, I had you on before, and for people that may not have seen that previous show, I want to do a little bit of a review because you gave us such good information on breast cancer that today we're going to focus on lymphomas. But before we do, tell us about this relationship between hematology and oncology. What's that all about?
So hematology is basically the study of blood, and that is disorders of blood, both normal benign disorders which are not cancer, as well as the spectrum continues to malignancy or cancer. So blood cancers as well as benign hematology is under the umbrella of hematology. Oncology is solid tumors, but at the same time there is an overlap. There are oncologists who also treat blood disorders or blood cancers, but they do not treat benign blood problems such as anemia, clotting problems, hemophilia, things like that. So that's where there was a need of understanding both hematology and oncology, and that's where there was a merger that people decided to, instead of having two specializations, both hematology or oncology, they decided to combine. So that's where, when I was trained in a 3-year, after completing my medicine training, I did 3 years of fellowship, which was both hematology and oncology. Some people, after taking that, decide not to take the hematology because it's a little more difficult board, because they ask a lot of benign stuff, which is more cerebellar. But like my boss from China, Dr. Yam Lung, he was a terrific guy. He still is. But so he used to say appetizer is hematology, but the main course is oncology. So that's where the lymphoma is.
Let me ask this question before we get into our lymphomas then. When you look at hematology, oncology, and the physician's ability to treat, is it, what age spectrum? Is it from birth or prenatally, if the infant is having, the fetus is having some difficulty before the birth, or is it, tell us that all the way to the end of the lifespan? Exactly, what's the age range?
So in medicine, everything is becoming specialized. We are focused on a particular age group. There are pediatric hematologists and oncologists who do a basic training of pediatrics, and then they go on to do fellowship in hematology oncology. So they are called pediatric hematologists and oncologists. They continue and they treat the patients up till the age of 18. So beyond the age of 18 is where people like me take over. So they graduate the patient over if they have a problem, say, for example, they have, say, leukemia, and they have treated the leukemia is gone, but they need that patient to be followed. So it look a little odd if a patient goes, a 42-year-old goes to a pediatrician's office. So basically after 18 years of age, they graduate them to adult hematologists and oncologists. So for me, I trained in internal medicine, which is people who or persons who are 18 years and older, and then subsequently we trained in hematology oncology.
Let me ask this question then, because you are with OU physicians at the Schusterman Center. In terms of people, if they want to access services there in hematology oncology, must they be 18 and older, or do you also have an area where the younger issues for pediatrics can be dealt with? What's the age for your area?
Sometimes it's a gray zone. I have also seen patients as young as 15, 16. Where they did not have a hematologist in town. But fortunately, we have a group in St. Francis who does see hematology oncology for pediatric patients. But like I said, sometimes the patients feel comfortable because their uncle and aunt is seeing somebody in our clinic, so they decide to also come along. So if they're 16, 17, we see him.
Well, let's look at our topic here, looking specifically at lymphomas. What is a lymphoma? Sort of clarify what that is for us, because people have heard that, but maybe not know what that means.
So first, let me go back a little bit and explain what lymph nodes are. I'm sure you've heard that when you're in, say, Target shopping, and somebody says, hey, look at you, your lymph node is coming out.
It's kind of like bulging
exactly.
inside your neck, yeah.
So you've heard of lymph nodes. Lymph nodes are basically the drainage system of our body. Any infection or inflammation happens, all the drainage goes into our lymph nodes. And that's where there are immune system or soldiers, which are both T lymphocytes and B lymphocytes. So those are the soldiers which, so B cells, so like I said, so if you could follow me, in the lymph node there are two cells, many more, but the two which I'm going to focus on, the B cells and the T cells. The B cells make the antibodies, and the T cells are the running men. They go and kill. So one makes antibodies, one is a smart guy who sits back,
just makes the stuff.
Exactly, and he doesn't do any more.
Right.
But then the T cells goes and kills.
There are killer people.
So exactly. So these lymphomas, they are, so leukemias are different from lymphomas. It's something people don't understand. Leukemias will kill you if you're within 3 months or less. Lymphomas won't kill you for 6 months. That's why you see those little old ladies who come to my clinic, they've got a boo-boo in their neck for a couple of months, and they're not paying attention to it until they go to Walmart and says, God, look at you. So that's when somebody pays attention to them, and so we take the lymph node out. So that's where we subclassify or break it into, coming back to the analogy. Back in the day, we used to throw Clorox and kill everything. But now we have targeted therapy because now our understanding of every cancer is much improved. So coming back to the lymph node, where the lymph nodes has two different types of cells, the B cells and the T cells.
Right.
And those B cells and the T cells originate from that when everything in life has a stop button. When my kids are eating too much chocolate candy, I tell them, stop. Stop, exactly. If they don't stop, I know they're not going to sleep till 2 o'clock in the morning. So that's when they lose their stop signal. So that's where cancer is. If those cells forget their stop signal, they start growing. And
they grow uncontrollable. They replicate at a really high rate.
So lymphomas, and this is based on smart people sitting in a room from different parts of the world. They classified lymphoma into two different big types. They call it Hodgkin's lymphoma and non-Hodgkin's lymphoma. The non-Hodgkin's is again divided into the cell of origin, if it's the B cell or the T cell. So I'm sure you've heard of chronic lymphocytic leukemia, the CLL, or there's follicular lymphoma. So there are different types of lymphomas depending, and the way we've classified them, the non-Hodgkin's, according to the cell of origin, and accordingly we have treatments against them. Like I said, 6 months, you're going to end up killing you. And again, that can also be always different. There are some lymphomas which are very, very aggressive, and they behave like leukemias. So that's why as soon as you see something, so people who present to us, they come to us, go to their primary care physician when they start losing weight. They're not wanting to lose weight, they're not on Jenny Craig, but they're losing weight. They're having night sweats. So, and they're noticing some lumps and bumps. So those are the red flags. When people start seeing those, they need to seek medical attention. And typically those are the symptoms when you have a lymphoma or something brewing.
We're going to take a really quick break and come back and pick up on those symptoms. And I want to get back to the B and the T cells.
Sure.
Please stay with us. We'll be right back.
Up to 40% of businesses never recover after experiencing a major disaster. Make a plan at ready.gov/business.
Welcome back to continue our discussion talking about lymphomas. Joining me again is Dr. Mohammed JanJua with the University of Oklahoma Hematology Oncology Department. Let's jump in. Now, you were talking about some of the symptoms in terms of losing weight and night sweats. Those are symptoms of many other kinds of conditions like tuberculosis with the night sweats, or diabetes, some of the other things, although there are other symptoms that go with them.
Right.
So if we're starting to experiencing some changes that are unexplained,
Right.
it's not like you're sleeping in a hot room. Well, yeah, you ought to sweat, but the room is pretty cool, it's comfortable, and here you wake up with night sweats to the point that you have to change garments.
Right, right.
Those are signs that you really do need to get to the doctor because
Absolutely.
something's going on.
Absolutely. And those are the red flags. That typically if you start having those symptoms like hot flashes, my mom called me, he said, I'm having hot flashes. I said, Mom, it's okay.
Right, you're about at the age where you should have hot flashes.
But at the same time, if you're losing weight and you're not trying to lose weight, you're not following Jenny Craig or things like that, then you know there's something which is different. And you start noticing these lumps and bumps. Absolutely go seek medical attention.
Now the lumps and bumps in terms of noticing, because you talked about that, how others may see, you know, your neck has a lump on it. Is it going to tend to be always in the neck region? Could it be in the arm area? Tell us where we might see these lumps and bumps.
Very good question. Typically we see the only way women really get attention is if they have a big neck. Men don't care, but women do. That's why I brought the neck. But
oh, thanks, Doc, I think.
So the lymph nodes are everywhere.
Okay.
They are in your neck, in your chest, under your arms, where your stomach meets your legs, the femoral region. So they're everywhere because your body needs a drainage system. So wherever there are lymph nodes, they can become enlarged. So what you will feel like you have tired, you feel like you're heavy. So these are non-specific symptoms, but when they come together, that's the point where you need to seek medical attention. What they do, typically what we do is, if there is a lymph node which is enlarged, we take it out and we look at it under a microscope and subsequently decide what type of lymphoma it is and subsequently go ahead and treat. But like I said, everything is so targeted. That means we have treatments which targets a B cell or a T cell because they have particular markers that we are able to hit. So accordingly, that determines how we're going to get response. But at the same time, there are some lymphomas that behave very, very aggressively.
Okay.
So you need to seek attention immediately.
Let me ask this question, because with the lymph nodes, sometimes as the patient or the person that's being affected, things will come and go. Okay, so in terms of the enlargement that you're talking about, is it going to typically come and go, or is it pretty much going to be there and maybe get bigger or stay the same size?
Absolutely. Like you said, the latter part, you will have those lymph nodes that stay large and they're not going away. I don't know, it's a subjective thing. If you see a lymph node and it's there, some people don't care about it. They'll forget about it for years. But what I want people to understand is that if you see something which is not supposed to be there, if your neck is size 16 and suddenly you feel like your neck is size 18, there's something fishy.
Okay, let me ask another question that I hate to cut you off, but you're talking about that size thing. Is it going to be where it is tender to touch? Is it going to be kind of, because sometimes pain will cause us to go get attention, but is this something that's not very painful? Is it soft or hard? What does it tend to feel like?
It comes in every different symptoms. I mean, it can be painful, it can be painless, it can be hard, can be soft, depending how, it's like this. You can, it's in a balloon. In a balloon, you can fill it up with 500 cc's of water. But same balloon, you can fill it up with 2 liters. So it's how, and by when you fill it up with 2 liters, it'll be pretty tight. So it's stretchability.
Okay.
But if you notice something, like I said, in the spectrum of all those symptoms, you need to seek medical attention.
Now, how young? Because sometimes people think, well, this tends to be, and does it tend to be a lymphoma that hits at a certain age? Tell us a little bit about that.
It's a very good question. There are some lymphomas which occur in younger age, from the age of 10 to 12 all the way up to 20, what we call Hodgkin lymphomas.
Okay.
Do they occur in older people? Yes, I've seen it, because to a hammer everything looks like a nail. But at the same time, typically like you said, lymphomas are in a little older age but there are some lymphomas which occur in younger people. For example, chronic lymphocytic leukemia, or what we call CLL. I have seen a 17-year-old with CLL. Typically, it occurs in people who are 60 and 70 years of age, but they occur in 17, 18 years also. So they can all, that's what I tell my patients. I've read the book, you've read the book, but the lymphoma has not read the book. So sometimes it comes in different shapes, sizes, and colors, which are different.
Right, so we need to pay attention to not only our own bodies, but our children or youth that are around us to see if there's some changes that you're saying. Now, go ahead.
If you don't, like I said, it's very important to seek medical attention. If if it is nothing, then we're all happy. But if there's something, we're able to catch it much earlier, because lymphomas can transform into a much more aggressive species. So if we will all be happy if it's nothing, but if it is something, we're able to catch it early and treat it.
Now, does lymphoma, like so many things do, but some don't, does it have a genetic component to it? Is it something that if you know someone in your family has had this particular disease or condition that you need to watch yourself? Tell me a little bit about that.
Over the last 10 to 15 years, we've been doing molecular research. We know the DNA much better than we did 20 years ago. So we know there are some lymphomas and leukemias which are genetic. There is always a genetic component. Are we sure of it? We know for a fact there are certain infections, like mono, like EBV. I'm sure everybody's had mono.
No, not everybody's had that. Doc, come on now. Come on now.
We used to call
but it is common, the kissing disease.
The kissing disease, yes. So that can cause a lymphoma, a pretty aggressive lymphoma. So we know that there is a genetic component. Can we pinpoint it? Not yet. We don't have a clear answer to that. But we have seen some lymphomas which are there in the father, the grandson, but so we're not completely sure. The jury's out on that. Okay,
but when you do have that kind of history, maybe more aggressive, attentive monitoring of yourself is required.
And that's where we all need to support the Leukemia Lymphoma Society, because that is supporting the research money going to leukemia lymphoma. We have a lot of research going to certain cancers and not to the others. That's why if you support leukemia lymphoma, more smart people can be hired to do research on those aspects. So,
well, when we come back, we're going to take a break, and I want to get back to, you talked about the non-Hodgkin's and the Hodgkin's lymphoma, and I really kind of want to throw leukemia in there, I think, to help us really clarify that distinction that you were saying many of us just don't realize there is one.
Sure.
Okay?
Absolutely.
Please stay with us. We'll be right back.
I am folding the pants. Do they go on my head?
Everyday moments can become teaching moments because learning starts long before school does. Give your child the start they need at bornlearning.org.
Welcome back. To complete our discussion on lymphomas, joining me again is Dr. Mohammed JanJua with the University of Oklahoma in their Hematology Oncology department. Let's jump in, Doctor. Now, I want to go back to the distinctions that you were making before and get a little more in detail about them here. The non-Hodgkin's and the Hodgkin's lymphoma, and you talked about the B cell being that antibody and the T cell, which is our killer guy or person. I want to be, gender specific, killer person. Tell us more about this. How are they distinctly different? And maybe there's some similarities.
Absolutely. So the mother is the same. It's a lymphoma cell or the lymphocyte. So the Hodgkin's lymphoma is typically in the younger age, and we think the primary cell, the mother, is a B cell. We think. And that's how it responds. Very aggressive. You need to treat it now or yesterday. Now, non-Hodgkin's. Non-Hodgkin's is a big division, divided into the B cell and the T cells. The B cells, there are some type of B cell lymphomas, again, what we call non-Hodgkin lymphomas, which are aggressive and not so aggressive. For example, which I was repeating before, chronic lymphocytic leukemia, there are some indications where you need to jump in and do something. But sometimes you don't need to do anything except watch and wait and only jump when there is a need to treat.
Okay, so you're saying that there can be some instances with these lymphomas
Absolutely.
where
you don't need to do anything.
Right, they don't progress very quickly. They're not going to all of a sudden jump off. But if they do, you're there. But
Absolutely.
You're monitoring to see at what point therapy is going to be the most appropriate.
That's exactly what you took away my words. You need to monitor them and see how their disease is behaving. Because remember, no two kids are the same. My 6-year-old and 4-year-old are total different personality. So every lymphoma, even though it might be under the same umbrella called CLL, one might behave different from the other. So even the same lymphoma or non-Hodgkin's lymphoma of the same type behave differently. You only, for example, CLL, we jump in, and that's a clinical decision. Some oncologists jump right in and treat. Some watch and wait.
Okay.
The jury is still out. There are maturing studies which are saying you should start according to the time of starting. But as soon as you start having the B symptoms, you need to get a biopsy, and that will classify and tell us what type of lymphoma it is. For example, there is a lymphoma from the B cells, which is what we call diffuse large B-cell lymphoma. Very, very aggressive.
Okay.
It will kill you in less than 6 months if you don't do anything. Because it's like this. Lymphoma is pretty interesting. It'll go, the cells, the blood cells are made in the bone marrow,
right,
which is the legs. Wherever you have bone marrow. So those lymphoma cells, they divide so fast that they really push out all the good guys. So they're dividing fast enough that it just pushes out every good cell. So it's going to kill you. The complications are going to kill you, not the lymphoma.
Okay.
Okay. The lymphoma doesn't do anything. It just pushes out every good cell. So the complications are you're at risk for infection, you are anemic, and you can bleed. Because typically we have 3 cells. One prevents us from bleeding, one which brings oxygen from one side to the other, and the third one is fights infection. Remember? The white cells. So it takes away your ability to fight infection, and you're keeping yourself oxygenated, at the same time bleeding. So the lymphoma doesn't do anything. It just kills the good cells.
Right.
So that type of, it's called a lymphoma, but it's very aggressive. Then there in the T cells. In the T cells, there are some lymphomas which are very aggressive, which is called angioimmunoblastic T cell lymphoma. Very aggressive.
Okay.
So you need to jump in and treat. Then there's another lymphoma of T cell, what we call anaplastic T cell lymphoma. Those are, again, there is ongoing research, and we are having some terrific, what we found is, if you have a particular ALK mutation, you perform better than your people who do have the regular anaplastic large cell lymphoma without that mutation. So our understanding...
let me ask you here real quick. When you say you perform better, does that mean you respond better to treatment?
Absolutely.
Okay, go ahead.
So you're a better player. So our understanding of the molecular biology of the tumor is so improved that we have markers on lymphoma cells, the B cells and the T cells. We have markers that if this is the B cell, it has a marker, for example, what we call CD20. We have drugs that go and sit on that cell and kill them. So it's like a beacon. And I don't know if you've seen, I used to be a Star Trek fan. So it puts a beacon on it, and wherever it goes, and it'll find, the torpedo will find its home.
Okay.
And it'll kill. So we call what we call targeted therapy. So treatment has dramatically improved. People who would die in less than a year are potentially being cured.
Now let me ask this, because in those aggressive lymphomas that you mentioned, because just because you have Hodgkin's doesn't mean it's going to be aggressive. It could be not as aggressive. So you're telling us all of these different varieties, again, like the 30 flavors of Baskin-Robbins.
Absolutely.
But in terms of the treatment of them and the symptomology, rather, would a person experience a greater weight loss? Let's say I don't know I have anything yet. And we talked about the night sweats. We talked about the weight loss. We talked about the nodule, the fatigue, and stuff like that. If I am experiencing an aggressive type, is that going to be accentuated I mean, to make me get there quicker, or not really?
It's like this. If you are, for example, 200 pounds, losing 40 pounds in less than 3 months might be dramatic for you. Not so dramatic. You say, oh, I'm losing weight. But somebody who's 100 pounds and they lose 40 pounds, it's a much bigger loss. So to answer your question, it's a very good question. How aggressive, if it's an aggressive lymphoma? Yes, we found that if you have an aggressive lymphoma, your symptoms, you will notice those symptoms in a shorter duration versus somebody who has, say, a little old lady that you see in Dollar General store who has been roaming around with that boo-boo in her neck for years. So you know that she has a very benign lymphoma. I'm just throwing things. But I don't know. The proof is in the pudding. The only time we take that lymph node out and study it under a microscope and do specialized studies, that's the only time I can tell you whether it's aggressive or not. But just the nature, I won't be able to tell you by just looking at somebody. But to answer your question, how aggressive the symptoms would be, with an aggressive lymphoma, the duration of symptoms would be much more, much less. And you'll feel a little that they're coming on much faster.
One last quick question. People want to know sometimes, are things in the environment causing us to see these things more, or might they increase the symptomology or the problems with it? For instance, if I'm drinking a lot of caffeine, or I'm living in a polluted area, do any of those things just in general affect that, or not really?
Absolutely. What we found is environment has a big, strong effect on causing the disease. People who, for example, in Russia, where they had the nuclear reactor accident, they got exposed to radiation. There was a higher incidence of lymphomas and leukemias in that area. People who were exposed to coal, dust, and all those, they got a higher incidence of lung cancer. So what we found is these chemicals which weren't there 300 years ago, people had a healthier life. They had less of these leukemias and lymphomas. But now with our changing lifestyle and more pollution in the air, more tobacco consumption, more alcohol consumption, we're seeing these much more.
So there are things that we can do to help ourselves. Thank you so much, Dr. Mohammed.
You're most welcome. Thank you for having me.
Thanks. Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your questions, comments, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/HealthAlertUSA. And remember, do what you can to take control of your health. And with symptoms that are just not your norm, no matter how small, see your physician. Take care.